that we see a patient, the moment that we see a neighborhood, a community. Diversity brings a lot of information. But if we do not know how to measure, it can create a problem. We cannot solve it. We cannot talk about it. And most importantly, our community suffers. One of the things that I see in my community, and especially with the patients that I take care of, is that being Latine, Latinx, Hispano, Hispana, Latinx, actually, it's a big group. And where I prefer a taco, someone else can prefer a pupusa. Where I love, certain things like spicy jalapenos with lime and sugar in my candy, other people could actually see that differently. Then going from these cultural and linguistically differences, we need to understand where we're coming from. Why? Because we know that at the moment that we present a language, a culture, and we cross that path and close that gap, most importantly, our patients and community are healthier. Our patients and communities have an opportunity and a better future to be healthy, to be there. Then that's why it's extremely important the conversations that we're going to be having today. At the moment that we have right now, and a lot of the surveys that we have in our healthcare system, in our public health system, and in a lot of other government-run information databases, if you get to the part of Latino, Latine, Latinx, Latina, Latine, that's grateful. But am I Mexican? Am I Zapoteco? Am I something else? Because all that information can make a huge difference. And especially now that we know if we're not counted and we're not represented, there will be no change for me, my familias, and my community. That's why it's important the things that we're going to be talking. I want to thank from the bottom of my heart all the founders and people that have made this possible. Part of the important things is that in order to bring this forward, we need to make sure that our communities are taken care of. And that's why a big abrazo to the LCHC amazing coalition, and also want to thank the Leadership Conference of Civil Rights and Robert Wood Johnson Foundation for this grant and funding. Because if it wasn't from you, we could not elevate this topic and conversation that we're having. Remember that a lot of the things that we have are related to our civic health and is directly connected to our physical health, where at the moment that we are represented, we're taking account for. And most importantly, we are out there voicing our feelings, our concerns, and the things and opportunities that our community needs. We can actually create a better future. A future where we have green spaces, a future where we understand the healthcare system in our language. We understand the culturally aspects that can make a huge difference at the moment that we're taking care of each other. And that's why I'm very, very, very excited to continue working with both my health that has been doing an amazing job for more than 6 years to make sure that all of us are there represented and have the opportunity to have our voice heard. And with this, I really want to invite someone special, someone that has been making a huge difference. His name is Esteban Camarena. Esteban is a fighter. And what do I mean with this? He has been part of voicing out how our community is heard, making sure that he's translating those efforts, those problems and voicing them out to create actions and move the health of our community forward. He's part of the Leadership Conference of Civil and Human Rights, and most importantly, he understands how can we create that conversation. As a first generation Mexican American coming from Arizona, he has seen a lot, and most importantly, the topics regarding enrollment, reproductive rights, voter registration, and other amazing conversations that need to be started, and most importantly, need to be changed. Then with this, I want to invite mi queridísimo Esteban. Esteban, how are you?
I'm good. I'm very good. Thank you for that introduction, Dr. Shapiro.
Welcome, 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 and the floor is all yours.
Thank you so much. And can you all see my screen? Good. Thank you for that introduction, Dr. Shapiro. My name is Esteban Camarena, and I am the field manager for Census and Data Equity at the Leadership Conference on Civil and Human Rights. And so when we talk about data, it's big and inflated, but when we break it down, data is not only about numbers, it's also about, and more importantly, about people and their stories. So my race, according to the 2020 census, is classified as white. And that's definitely not my story. I am a first generation Mexican American raised in the south side of Tucson, Arizona. My parents immigrated from Sonora in the 1990s. I am my family's first college graduate, the first to get a master's degree. I am a Chicano, I am Latino, I am Mexican American, and that is a story I want to tell through data. So one of the routes to reaching data equity is through data disaggregation. Data disaggregation is a process of breaking down large quantities of data into smaller units to better understand and to identify inequities that exist. So in 2020, among people of Hispanic or Latino origin, 26.2 million people, about 42.2%, identified as some other race, of 41.7% change from 2010. So, as many of you know, the Latino community, especially in California, is rich and diverse and can be multiple races and ethnicities. When we are grouped into one large category, such as Hispanic or some other race, the richness and diversity of our communities are overshadowed, which can hide inequities that exist within our communities. And the same can be said about many different communities throughout California and throughout the country. So if we take a quick look at this graph, we can start seeing the benefits of disaggregated data because we can see how when the aggregate data, when we disaggregate data, it's broken down and we can see different disparities that exist even within um, certain ethnicities and communities. So in this one, and this is a beautiful report by Community Counts, and I'd be happy to share this link with you all. We have disaggregated it, broken down for ANHPI communities. And so if we start thinking about how race and ethnicity data is used, we can start seeing how it can be used to ensure equal opportunity, enforcing civil rights laws, analyzing impact of policy changes on specific populations, administering programs for specific populations. And so not only does this affect the census, which is a huge source of information and data, but also through the American Community Survey, which allows us to look at data at a more granular level. So when we ensure equal opportunity, when we look at, I'm sorry, let me go back real quick. So when we see how race and ethnicity data is used, it's to ensure equal opportunity, enforcing civil rights laws, such as Equal Access to Housing under Fair Housing Act, the Opportunity Act, and actions against racially and ethnically discriminatory law enforcement. So it's important to collect race ethnicity data because we're able to defend civil rights and identify inequities in health and start really developing policies to help reverse these changes. So if we consider the COVID-19 pandemic, data on infection rates and healthcare disparities among different racial and ethnic groups underscore the urgent need for accurate information to address health inequities effectively. Equitable data collection plays a pivotal role in tackling educational disparities, criminal legal reform, voting access, economic opportunity gaps, and much more. Without comprehensive understanding of the unique challenges faced by various communities, we risk perpetuating systemic inequalities and hindering progress towards a fair and just society. Data disaggregation also allows us to identify inequities that exist and begin to create solutions to eradicate those inequities among BIPOC communities. So, as some of you know or may not know, OMB's Directive 15, which is the Statistical Policy Directive number 15, sets a minimum set of categories that federal agencies must use when they collect information on race and ethnicity. So the former standards, and actually it'd be better if we go to this slide here. So we can see in this slide, the former categories where it really doesn't allow people to really reflect themselves in the data. And it's important to mention that MENA, Middle Eastern North African category, was not included. So these are definitely something that we have worked on in collaboration with LCHC, with Altamed, to start eradicating this inequity and really working towards a questionnaire or census form, ACS forms, that truly captures the diversity of our country. So we've been working over the past few years to help call for revisions, specifically adopting a combined race and ethnicity question format, because research shows that people who identify as Latino, Hispanic respond more and are better represented in the data with this combined question format, adding a discrete ethnicity category for people of Middle Eastern and North African descent, and requiring, rather than simply encouraging, agencies to collect and publish disaggregated data whenever possible. So the new standards, which we are very pleased, has an adoption of the combined race and ethnicity standard, has the MENA category, and instead of requiring it, really requires state agencies to collect this sort of information and disaggregate that information. So we had hoped for more research and testing, particularly to provide for better signaling and examples to elicit more accurate responses from people within intersectional identities, that is, with more than one racial and/or ethnic identity, which would allow for more complete and nuanced understanding of racial identity, especially in regards to the Black diaspora. So we will continue to call upon OMB and the Census Bureau to use that opportunity in conjunction with robust community engagement to ensure that, as implemented, the standards provide a better understanding and more accurate data across all of our communities. So it's important to mention that the last time these standards were going to be implemented in 2016, the Trump administration quickly reversed those changes without reason, which shows that it's important to make ourselves heard at the ballot box. So which of our desired revisions were implemented? Adopting the combined race and ethnicity question format, adding the MENA category, and requiring for data disaggregation. And so we have an implementation timeline. We have in 2024 of this year where OMB announces the changes. Up next, we have agency action plans to implement the standards. So agencies have about 15 months to develop an action plan in the hopes that by 2029, most federal agencies will be in full compliance, which will have a direct impact on the 2030 census and the ACS, the American Community Survey. But there's a lot of work to be done ahead. So we have the intersectional visibility. So while the new standards should lead to better data for most people, signaling, education, and engagement must be done for those who identify with more than one racial or ethnic category. Detailed categories. So OMB has already specified required detailed categories prior to engaging in the due diligence research and testing as to what would elicit inclusive and accurate responses for those who identify with more than one racial or ethnic category. And we also urge OMB and the Census Bureau to engage in research and testing to address these concerns, especially as it refers to the Black diaspora and other ethnic minority groups. And as Dr. Shapiro said, there's a lot of work ahead in terms of community education. So while the new standards do not have explicit signaling for Afro-Latinos, Afro-Arabs, flexibility of the new standards allows us for such identification. Um, and community education is going to be really important and crucial. So it's important that we're having these conversations now to start developing educational plans to help folks know what these standards mean for them. The detailed categories, while we have data disaggregation by default, agencies can engage in a process to opt out of such collection. So we obviously in an ideal world, we want all agencies to adopt the standards. So we need to engage with federal agencies around the necessity of collecting disaggregated data to ensure that they actually do. And then implementation. So the Interagency Committee on Race and Ethnicity Statistical Standards, it's a mouthful, will be working on implementation and guidance. So we must work with them to ensure that that guidance and signaling and coding all work towards better reflecting our communities. And so by fostering partnerships across sectors and leveraging the insights gleaned from census data, we really have an opportunity to not only illuminate inequities, but also to drive meaningful change from the ground up. We are committed to centering the experiences and aspirations of those whose stories are often relegated to the margins. And together we can explore innovative strategies, share best practices, and chart a course toward a future where data serves as a tool of liberation rather than oppression. So to achieve a more prosperous shared future, it is crucial to shift the public narrative, have those conversations with community groups, to really start building that trust towards completing the census and the ACS, because this is going to have a profound effect on the Latino community, on the Latinx community, and Indigenous communities. And I encourage you all to stay engaged. We have a great partnership with LCHC and AltaMed to really start providing the resources and educational tools to start shifting the narrative towards a more inclusive and multiracial democracy. So, and I'll share all these links with you all as well. So on that note, I will pass the mic to Dr. Ceci Aquino, who is the Executive Director of the Latino Coalition for a Healthy California, the state's only Latinx-led statewide policy and advocacy organization. LCHC works to protect and advance Latinx health equity, and they have been champions of data disaggregation along with community leaders, advocates, and advisors representing many Latino, Indigenous, and Mesoamerican communities throughout California. So on that note, I will pass it off to Dr. Aquino.
Thank you so much, Esteban. Y muy buenas tardes. Thank you, everybody who is able to join us today to have this important conversation. And we're amongst familia, right? This is how we get the word out as Latinos, is by having those cafecitos with one another, making sure we're calling the comadre so they know the latest updates. So we trust that you all who are listening today will be able to take the message forward and share it with all of our different networks. So as was mentioned, I am Ceci Aquino, Executive Director at the Latino Coalition for a Healthy California, where we fight to address health inequities in the Latinx community by centering community wisdom and making sure we're advancing sustainable change through policy, legislation, and budgetary action. Just to give us a little state of the state for Latinos and Indigenous communities in the state and California. So Latinos and Indigenous communities represent 40% of California's population. We are the largest racial and ethnic group and expected to increase. In 2023, the Latinx share of the GDP across the US was 3.2 trillion. If our US Latina GDP were its own country, we would be the 5th largest economy in the world. So really think about our impact. It's not just our amazing culture, our amazing contributions to our society and this country, but if you think about health as a determinant to keeping an economy healthy, because guess what? Healthy communities will show up to school, will show up to work, will make sure that they are spending those dollars. And we saw it during the COVID-19 pandemic, right? Latino and Indigenous communities kept the economy running. And so it's a sound economic decision and solution to ensure that we're keeping our communities healthy, in turn to keep an economy healthy. In terms of our public health standing, so the Latina community is significantly different post-pandemic. You know, we are at the point of being post public health emergencies, right? Where we saw many increases to the safety net, programs that came out to support. And during that time, we saw communities being lifted out of poverty, which means that when you strengthen the safety net and you ensure that communities have access, not to just healthcare, but food access, cash incentives to support the rent payments, you name it, those safety net solutions were able to keep our families with a roof over their head, with food on the table, and being well in a very difficult time. But post-pandemic, we're in this recovery state where our communities are still facing acute COVID-19 cases, long COVID-19 cases, and then the socioeconomic repercussions of the pandemic. For those of us who had the privilege of having a job that carried us through the pandemic, a lot of community members did not have that privilege. And so for many, they're now just making rent payments. They're just being able to get back to support their families. And so we have to take a very intentional lens at how we approach Latina and Indigenous communities and support them in this recovery. Again, these disparities existed way before the pandemic existed, and we have been historically disenfranchised as a community, many times being pitted against other communities of color for resources. But we're beyond that time. We are stepping up and saying we are working hand in hand with other communities of color, Latina and Indigenous communities, with Black communities, with Asian communities, with Pacific Islander communities, to say enough. When we raise one community up, we're raising all communities up. So this work that we do is really about justice and ensuring that we are breaking poverty cycles. Now, to that piece, data is very important. So data, unfortunately, is not unbiased. The way that we talk about data, the way that we craft a narrative around the numbers really can guide resources, can guide attention, can tell a story that either hurts or helps our community. And so when it comes to the OMB changes, when it comes to data within the state, it is really important that we're capturing the full diversity of the Latina community. And so top line, the OMB standards that Esteban walked us through, and these updates that were much needed, are very timely, right? They come at this time that we are facing the post-pandemic recovery, and we are, a couple of years before the next census, but it's really time to prepare and share that information with community, make sure that we are providing that education, providing that guidance on how to navigate that information so that we're being able to self-identify with those forms and be able to be counted. During the last census in 2020, more than 43% of Latinos did not respond to the question. And if you all remember, we've all engaged with the census forms, right? It was a very confusing question. It was the double question that said, are you Hispanic or Latino? Yes or no? And then what's your race, right? And I think most of us were stumped. Well, I just answered Latino. Why do I have this other question? And I don't identify with any of this. So that's where we see that percentage, right? Where folks just left it empty. They didn't answer it. And I think those results really showed this need for our community to push for a different kind of question. So the conversation that we even get to have today is a testament to the amazing advocacy that has happened over years right? Over 30 years or more of our community saying this is the way that this question should be asked, and this is how we want to be represented. And so, like we said, this is a first step. It's definitely not perfect. We can see the Latino and Indigenous community represented in 2 of those sections within the OMB combined question, both in the Latino section, but also in the Alaska and Native section. So our Indigenous communities are represented in that American Indian and Alaska Native section for both Mayan and Aztec communities, and it's a write-in. And then in the other section, there's a couple of countries that are identified, but it's also a write-in. So for example, I'm from Guatemala, so I would write in Guatemalan, right? So it's, again, a lot of education and making sure that we're telling our family members and our friends to make sure that they're taking advantage of this change, to make sure that we can self-identify in the way that we want to. Additionally, our Afro-Latinx community needs to know that they can also pick Black in the different sections. So our intersectional identities should not be erased because of the way that the survey is set up. So again, education to make sure that we can self-identify the way that we identify and see ourselves and are fully represented on paper. With that, right, in California, we're privileged to be in a state that cares about health equity, where our advocate communities, where our legislators, our administrative leaders are working hand in hand to make sure that we're advancing that conversation. And many times it's difficult, right? We're talking about a budget deficit this year that led to many hard decisions. But at the end of the day, the way we started the conversation today, right? If we're not ensuring that we are centering health equity for communities of color, and specifically today to Latina and Indigenous communities, then we're endangering the well-being of the state. And so for California, it is our duty to go further than these OMB standards. So our bill, SB 1016, Latino and Indigenous Disparities Reduction Act, was born to address this. In our community, we are not a monolith. We are beautifully diverse. And so we partner with amazing Indigenous partners, Cielo, MICOP, CBDIO, and put our heads together to say, how do we build a sustainable policy solution that will enable us to make sure that our communities are being seen for the way that we are interacting with the safety net programs of the state, with the healthcare programs of the state, and that we're able to dig deeper into the disparities within the Latino and Indigenous aggregated data. Because as we know, the color of our skin, the way that we speak, the language that we speak, can have a huge effect on how we experience the systems around us. And so many times in the aggregate data, those specific challenges that certain communities face are hidden because it's not clear how they experience it. But when we disaggregate and break down that data into more detailed pieces, we're able to identify disparities that then we can more intentionally address with resources and with more specific outreach. And so with our bill, this is our second year. Our first year, we moved through the legislature with unanimous support. We got to the governor's desk, and unfortunately, it did get vetoed last year due to the OMB changes that were coming down. So now they're here. The changes are here. They're in implementation mode. So that no longer is a stopping block. If anything, these changes now give us an even better opportunity to address this within the state. And so for us, right, this information will make a huge difference for the community. And I always like to remind ourselves that we're not doing it alone. This work really was influenced by the work that the AAPI community has led with AB 1726 and their data disaggregation work that's already in implementation mode. So we were able to use that as a blueprint to say, we were able to do this for our amazing AAPI community. Now it's more than enough time for us to be able to do the same for our Latina community and be able to address our health inequities through data disaggregation. I think many times data can be kept at the academic level, right? And the data gurus figure out the back end. But for us, it's really important to communicate that data can save lives. And so the conversation that we're having today is really about justice. How can you get involved? You can come support our SB 1016 work. We have officially moved out of the Senate and we're off to the Assembly. So please, if you would like to support our campaign, come reach out to us. We would love to loop you into our work. And for the OMB changes, start spreading the word and start sharing that information out into our communities. All right, so up next, I have the amazing pleasure to bring in this poderosa mujer, la doctora Gloria Montiel, who is the AVP of Grants and Community Health Research at Ultimate Health Services. She was among the first documented PhDs in the United States and continues to advocate for health equity and educational opportunities alongside immigrant communities. Bienvenida, mi mujer, es un placer.
So much, Dr. Aquino, and everybody for joining us here. So how go then from this idea of having new standards and thinking about data into actually implementing alongside communities? I want to share one of the projects that my community organizing and research engagement team is doing, and it's a research project around Latina houselessness and the rates at which folks in the Latina community are experiencing it, but also how their experiences differ. And we've been conducting focus groups now for about a couple of months, and we've also been training community scientists around the process of research, collecting data, analyzing data, and ultimately also disseminating data in partnership with us. And one of the findings that, or a couple of the findings, just as we've begun speaking to people through focus groups, is that although we have seen through kind of these point in time counts that Latina homelessness has been increasing, the other challenge that we have is that there aren't enough resources from HUD or county resources going into Latina communities. And as we started working through definitions in our focus groups and asking community members as to how they identified with current definitions of houselessness or homelessness, we started hearing that the fact that they perhaps are able to rely on social networks and rent a couch or a closet that fully doesn't leave them unsheltered, yet still doesn't give them the autonomy of when to cook, how to cook, etc. within an apartment complex, means that because they have a shelter over their head, they can't access the HUD resources that require someone to be fully on the street, for example. So that showed us that the experience of our Latinx communities experiencing homelessness or houselessness isn't included in current definitions. And that's one clear signal to us that current data and the way that data shapes definitions for programs and gives people access to real funds and real programming isn't there for our Latinx community. And so that's one of the requests that our community members are asking: how can we now require more data or make use of data that we're collecting through this program and advocacy to shape those definitions? The other piece I'll mention, or another example, is that during COVID-19, before we started vaccine implementation in Orange County, we weren't even releasing data around COVID rates per zip code. And we know that zip codes are also very tied to race and ethnicity, and we can chart sort of how race, ethnicity, income, and also then different disease measures such as diabetes, COVID-19, et cetera, map onto each other. And the county wasn't yet releasing that data. And as soon as there was advocacy around releasing that data, we could see patterns that started to shape immediately. And so what that means to us at the community level and from a healthcare perspective is that rather than just kind of collecting data because it's required, that we really need to think through about how is the data that is available to us helping us shape decision making around interventions, around who to prioritize for communication, around shaping the types of communication. Dr. Aquino spoke about the importance of language, for example, and knowing that even though, yes, the majority of Latinx communities may speak Spanish, that the Spanish may be different from one community to another. And also there are indigenous languages that haven't been yet recognized or put forth in a healthcare arena. And those are the pieces that we need to start thinking about then how to use data. The other piece that this conversation requires is that even as we make big gains around collecting quantitative data, is how do we then root also in beyond the numbers? How do we begin to tell the stories that shape these numbers by taking leadership within healthcare settings in our community needs assessments, for example, to elevate those unique populations or communities that are not often reported upon? How do we leverage other communication mechanisms to uplift those stories in the presence of these other communities through qualitative storytelling as well, narratives that really highlight the strengths of other communities. So it's not just using the data from a needs-based perspective, but through the data also identifying the assets within communities that can allow us to make choices around where to invest, how to strengthen certain assets that can embed health and promote health within these communities as well. And then the last thing I'll note too is in terms of something we've been learning around data collection within the healthcare system, that sometimes this perception of stigma around particular experiences that communities are having come into play as they're responding to some of these questionnaires. So as healthcare system specifically, we have to think through what is the process for data collection? How can we make communities comfortable, trust the fact that the data that we are collecting, that they're part of that process as well, that it's not just us as a system collecting data for some mysterious purpose, that we can clearly delineate a pathway for collecting that data, shape integration of community input and community participation, and then what is the outcome of that? How does it help us to know the breakdown among our Latinx community? How are we then directing our programming, our investments, our advocacy around what we learn from the data? And so one of the things that is really important for us as a community organizing and research engagement team, but ultimate as well, that we start thinking about it, is how do we embed community and patient participation across the spectrum of data collection, data planning, data analysis, and ultimately data dissemination. Like Dr. Aquino mentioned, we don't just want to collect data so that research scientists or some type of healthcare executives make decisions here, but how are we taking the steps as a healthcare system and as a community to bring back those data back into community and share what does their community profile look like? What does this mean? If this is what the profile is, how are communities prioritizing advocacy efforts, requests for funding, et cetera, and make them, community members and patients, part of that process? And I think it's only in that process that we can really get to a place where community themselves own those data and then can help partner with all of us on the administrative or executive level, research level, to really make changes and leverage these data points as a tool for advocacy and social change. So excited to be part of this conversation. Dr. Shapiro, I'll turn it back to you for some Q&A, and then we hope to answer and engage in conversation here.
Familia, you have heard a lot of amazing information, and the story goes like this. If we don't see it, We don't measure it, we do not understand it, and we cannot change absolutely anything in front of us. That's why it's so important to connect the dots of what we have right now in our hands and use the tools that we have in our state to make sure that we, as Dr. Aquino actually shared it, as Esteban actually highlighted, the roots and the way that we can proceed, and most importantly, the actionable things that right now Dr. Montiel is actually sharing with us, because we're not alone. And we can actually say that we have all these things around us, but the key here is what's next? What are we going to be doing about it? And how can we connect absolutely everything that we have for us? Then, if it's okay with everybody, and please, familia, if you're hearing us, send us your message via the chat. Right now, our amazing friend Octavio will be checking from Fortis Square and everything. He will be checking absolutely everything and sharing your questions. But I have a couple of questions that we already have. And this first question is for Dr. Aquino. What steps is LTHC doing to make sure that we are moving forward with understanding? And you mentioned that 40% of the Latinos that we have here in California are from the indigenous part of our community. Then what are we doing to actually advocate in those spaces?
Yeah, definitely. Great question. So, I think the fact that our communities are not a monolith, right? The fact that we're beautifully diverse and we have Mixteco communities, Mayan communities, Purepecha communities, these amazing communities that add that vibrancy and amazing wisdom to the way that we do life, right? It's important that we center their voices. I think many times advocates can get a little bit ahead of themselves and advocate for folks who have a very strong voice, who are present, who are around us, who are leading the amazing work. For our partners, Cielo, MICOP, CBDIO, they are leading the health justice movement for Indigenous communities, and they have had to create the systems that unfortunately the bigger systems have left them out of. So they have been hard at work tracking data for Indigenous communities, creating maps that highlight where Indigenous communities are found, be it in LA County or in other areas around the state. And so they are powerful. And it's about opening up opportunities, opening up the floor and saying, here's a mic, right? What do you need? Communities have the answers, they have the wisdom. And so it's about taking a step back and really listening to say and to hear what communities have to say, and in the way that they're prioritizing the way that they need the health and safety net programs and systems to respond to their needs. And so it really is about ensuring that as we talk about Latinos, we're not invisibilizing or, taking over the Indigenous work, because we are together and we are a community that is stronger together by acknowledging our unique differences and our beautiful diversity. I'll pause there.
Muchísimas gracias. And you bring a couple of interesting points, because that diversity, that understanding, actually it's connected with the census. Then I would like actually Esteban to see, like what changes are anticipated regarding the census in the way that it's implemented with these new standards.
So I think it's important to mention that implementation is not scheduled. Full implementation is not scheduled until 2029. And I was just responding to Robert Blackman's question on the chat. And before then, the OMB will, and the Census Bureau plans on conducting research and field tests on the question to see what the results are. And so in the meantime, I think it's important to, as community advocates, really start educating communities on what these changes mean and what the implications that they have. And so as many of, as Dr. Montiel and Dr. Cecia have mentioned, the new standards are going to require a lot of education to really kind of build that trust, because there's such, and with good reason, there's a lot of mistrust of the federal government, especially with anti-immigration sentiment that is pervasive. It's incumbent upon us, being trusted messengers, to really bring this message to our community and our people.
Thank you so much, because that's one of the things that we need to figure out for our future, because there's a lot of kind of sheltering, and I'm hugging myself, because when we were starting to talk about the census, and when you see the question that we need to know, a lot of the sentiment that we have needs to be clarified. We need to give that security, and most importantly, help our communities understand why this process is, it's actually very important. Es sumamente importante. It's very, very important for all of us. Then, Dr. Montiel, this question will be for you. A lot of the things that you have shared with us, and especially with the field work that you do in Altamed, to make sure that we are understanding where we are with research, with data, and understanding how can that be converted to an actionable thing. Then the question is for you. Um, a lot of times, we have learned on how to put together teams and how to create funding mechanisms and how to build that conversation as part of the community, because sometimes we don't see community clinics or community actors as part of that amazing machinery. Then if you can actually help us a little bit more on how can we better serve our community, expanding that diverse capacity with staffing, with ideas, with research.
Yeah, and it goes to the question that Kat also asked here in terms of the action piece. And for us, it's really important to engage communities at every step of the way, like not even beginning a data collection process until we've asked and consulted and really planned with communities around why are we collecting these data? What use do you want to come from these data as well? And I can cite one example that we're doing around a structural racism grant that we have applied through the Office of Minority Health. As part of that, community members are engaged in a process of doing a needs assessment within their community themselves. After the needs assessment, they identified kind of some of the priority issues and are now planning awareness campaigns around that. And from that, they themselves will select what campaigns they want to for advocacy around issues such as food insecurity, healthcare access, the environment, for example, or healthcare itself as well. And so that's the piece that's all being led by community members as well. They're the ones that are engaging their vecinos, their tias, everybody around them to really think through about how are these data applicable to us. And for us, that action piece is exactly there, not just collecting data for the sake of collecting, but also for that action. And what does that mean? And for us, that's the other reason why we spent the last couple of years training community scientists, folks who are knowledgeable about the research process, about how to ask questions. They may not be able to run your regressions or do any of that complex math, but they can ask the right questions and then inform the interpretation of that too. So it can help us decide how to implement program, how to plan programming, how to make investments, etc. But all of that with community engagement across the entire cycle.
Thank you for that, Dr. Montiel. And there's a lot of questions that are coming right now on the chat. One of them, and this is actually for the three of you, because this is important to highlight on where we are, because California is very has a special flavor, and talking about ethnicity and talking about history. Then the question, and if it's okay, I will start actually with Dr. Aquino. After that, Esteban and Dr. Montiel. You will be the last one on the same question if you would like to participate. Then how does California compare to other states in progress on Latine, Latinx, Latino, Hispano, Hispana data disaggregation?
That's a great question. I think California, as the Golden State, right? We are privileged to be in a leadership role and in many ways leading the country in the health equity work that we do. We can talk about health for all, right? Making sure that we're increasing medical access to everyone, regardless of their citizenship status. We are expanding access to other safety net programs. And we do this because that's part of our values as a state, right? Making sure that all Californians are protected. When it comes to data disaggregation, there is still some work to do. And that's why bills like SB 1016 are so important, because we're just beginning to crack those systems, right? And it's understandable. I think many times there's a lot of red tape in administrative settings, right? And in big infrastructure system changes can take a long time. But as understanding as we are of the difficulties and the complications and updating those, I do believe that our state leaders like Dr. Galley do have a very important and aligned value with us in that data disaggregation is extremely important. And there are many efforts that are being made. And I'm sure that with our work with SB 1016 and ensuring that this year we get it signed by the governor, we are working hand in hand and saying it's time and this is something that we have to do. We have already heard that our amazing administrative partners at Cal HHS are preparing a plan, and they're using blueprints like the AB 1726 bill for API community and our SB 1016 for Latino and Indigenous communities as the blueprint to help support the implementation of the OMB changes that will come down the way. So it really is about partnership. There is much left to do, but we are taking those steps forward, and there has to be a way to start, right? This is only the first step, but we can envision a more equitable transformation of our data systems by coming together and centering community and our diversity.
Sorry, I'm multitasking here because my computer was not working. Then I'm using my amazing phone right now for this. And that's an amazing way to connect the policy part with actionable things that our community can do here in California with tangible things. Because a lot of the times it's like, yeah, we need more data. But right now, thanks to your leadership, we're advancing on that part with concrete steps that are suggested for our community to take. Then, Esteban, I'm going to move towards you. And right now we're getting close to the end point here. Then I'm going to change the question for you, Esteban. What's next? What's the call of action for all of us?
So even for me, like I will tell you straight up, I'm not an expert, and so I'm constantly learning and trying to just be a better communicator, and especially with these terms because they're very technical. They can be technical, but I think when we understand it and we put it down at the granular level, I have my tia Maggie. She always says "papelito habla," which infers that, if you don't have it on paper, it doesn't exist. And so when we're talking about data and data collection, I think that's what we're talking about. We're talking about making ourselves known on paper and really using that information to help address inequities, help identify gaps that exist. So when I'm thinking of data, race, and ethnicity collection, especially when it comes to language access, if we don't know that someone needs interpretive services, if someone needs translation services, because there's no data to prove that, then these services aren't going to be provided, and unfortunately, people tend to fall through the gaps. And so, next steps is for us as advocates and for community leaders, really inform ourselves on what these changes mean, and then using that knowledge to connect to communities and just having simple conversations of cafecito here, tecito, and start really just talking about it. And because these are going to be important changes, and they're really going to elevate the conversation and change the narrative on what these changes mean. And I'm actually dropping in the chat right now a full report of the landscape analysis of data disaggregation across the states. California is definitely one of the leading ones, but there's always room for improvement. And because it's not perfect and it's such a nuanced thing that there's always room for improvement.
Thank you so much. And Dr. Montiel, you're our closing remarker right now. You have seen what's happening with our communities. You have seen the importance of actually gathering the data, understanding and creating policy to make sure that, it's not just that we're talking about it, but converting it. What will be your last thought?
Yeah, if we think about the infrastructure that we built during COVID-19 to reach communities deep on the ground, let's not forget those infrastructures and networks that we developed around trusted messengers, people that could actually reach communities that are not often represented. Let's invest back in those networks, in that infrastructure, and activate them around the same issue of information about engaging to combat misinformation, disinformation around these new standards and around giving our community really the tools and the power to collect data that can then result in action. And I think if we do it in that way and really equipping our communities with the power and the resources to get us to the next step around data collection, analysis, dissemination, and action, we can't fail.
And with that, I really want to thank again, our founders, the people that actually created this grant, the opportunity to work with the Latino Coalition of Healthcare for California, and of course, Esteban and Dr. Montiel, that has been an amazing, amazing leader with absolutely everything that we have done, and the leadership of Dr. Aquino. Right now, we're moving forward to a lot of things. We have heard right now with our amazing speakers on the importance of connecting the dots, of that light inside of darkness, to actually know how can we talk about it. Maybe we need more help. Maybe we don't. But right now, we simply do not know. And we know right now that at the moment that we create information, we can actually approach language barriers, cultural barriers, and bring back the quality of services that our community needs. And that's from healthcare, diet, public health assessments, and also representation. Because if we're not creating that space, we're not moving anything forward. That's why it's so important to understand civic health. That's why it's so important to understand data disaggregation, understanding what really is happening. And most importantly, understand that my vote is my health. Because at the moment that we want to create a better, healthier community, we need resources. We need knowledge, we need information, and the research, the presentation, the representation, and most importantly, the policies that can actually create a healthier future for our communities. I leave you homework for all of you to make sure that you reach back to us. We have 3 amazing panelists in front of you. We are here to create conversations, to add research, knowledge, what worked, what didn't work, and most importantly, to make sure that the policies that we are talking about, the things that we know that our community needs, are part of absolutely everything that will be the future of our community. I want to thank absolutely everybody that was actually on the background, Cynthia, Robert, Octavio, and all the team that made this possible, because without you, we couldn't be here. Familia, take care, and thank you for being with us.